Hello, I'm Dr. Simon Otto, and I'm presenting an abstract on our evaluation of progress towards integrated antimicrobial resistance and antimicrobial use surveillance in Canada. Thank you to the Public Health 2020 conference organizers for the opportunity to present this abstract virtually. I want to highlight Misha Miazga-Rodriguez, who submitted the abstract but was unable to present. You will see in our project team, made up of Misha as our research associate and myself within the HEAT-AMR research group, of which I am the lead, situated in the School of Public Health at the University of Alberta, and our colleague, Dr. Lynora Saxinger, from the Faculty of Medicine and Dentistry at the U of A. We want to thank the National Collaborating Center for Infectious Disease for funding the project and support from the U of A Graduate Student Internship Program. Thank you to the interviewees and reviewers of our work. And I have listed here my grants, collaborations, contracts, and committee co-chair positions. The objective of this project was to assess the progress made towards strengthening integrated AMR/AMU surveillance in Canada by first cataloging the surveillance programs currently operating in Canada at the national, provincial, and territorial level, to describe the scope of these programs, and last, to evaluate the progress made to fill the gaps that were identified in two key surveillance reports, which I will now highlight. First is the 2014 NCCID surveillance report that made a list of comprehensive recommendations to improve integrated surveillance in Canada. This dovetailed nicely with work done that I co-chaired for the Canadian Council of Chief Veterinary Officers, where we explored how we could improve antimicrobial use surveillance in animals in Canada. So we combined these recommendations for evaluation. When Misha began the project in terms of gathering evidence through a literature search and interviewing subject matter experts, it became apparent that we did not have a tool that we could use to formally evaluate progress. Misha went into the literature and first found a framework designed to evaluate the capacity for sustainability of public health programs. The framework included 9 program elements, which we solidified into 7 for our use: funding, organizational capacity, partnerships, program adaptability, communication, strategic planning, and enabling policy. Misha then used a tool designed by the World Health Organization to evaluate national progress towards implementing plans to align with the Global Action Plan for AMR. This system had a 5-point rating based on level of program element development. We modified these levels slightly into ranging from exploration to sustainable operation, and created definitions for each of those 5 for each of the 7 program elements into a rubric, which we use to evaluate the program components for AMR/AMU surveillance. Misha reviewed 6 national, 20 provincial, and 1 territorial surveillance program and interviewed 28 subject matter experts. This figure shows the distribution of interviewees across the country, as well as different surveillance programs in human and animal health. This excerpt is meant to show a snapshot of some of the results. So to start with, we realized that the recommendations in the 2 reports needed to be updated for the current environment. So we revamped those into 8 key surveillance program elements for evaluation, including subcomponents under each of these. This excerpt here shows the application of the rubric to the first national integrated AMR/AMU surveillance system with the subcomponents. And you can see these are largely in exploration. So this is one example. When I move to this figure, I want to show you the collective assessment of all of the 8 recommendations and the subcomponents. So you can see the list of 8 here. The subcomponents are not listed because of space. But the first thing I want to highlight are the areas where we are doing well, with a lot of elements in full and sustainable operation. National human AMR/AMU surveillance components, animal AMR/AMU surveillance components, animal antimicrobial use indication data, and some policy improvements to improve antimicrobial stewardship for animal health. These largely refer to existing programs, the Canadian Integrated Program for AMR Surveillance and the Canadian Nosocomial Infection Surveillance Program, which existed prior to 2014, and they have made great strides towards these surveillance components. Where we are still lacking here at the top is a truly national integrated AMR-AMU surveillance program, where a lot of pieces still reside in exploration in the lower levels. We can also see here that there are still some concerns and delays and concerns about timely integration and reporting of data, as well as the formal recognition of One Health policy for antimicrobial stewardship. The Pan-Canadian Action Plan is using One Health principles, but there's no formal One Health policy. There are a lot of detailed findings in this report, which is pending, but I want to highlight the key findings of our work. First, in 2015, the Public Health Agency of Canada created the Canadian AMR Surveillance System, or CARS, designed to integrate AMR and AMU data from the federal component programs. And they do this well, and it is quite timely. However, there's no new national surveillance program since 2014. So we are still lacking a truly comprehensive integrated surveillance program. There have been positive expansions of components within the national programs of CPARS and CNISP. For example, expanded farm components for feedlot and dairy sectors in CPARS, as well as some initial expansion into community hospitals and northern surveillance for CNISP. The concern is these are mostly still time-limited, project-funded components, and there are still important gaps within the surveillance framework. The representation of human surveillance in community settings, Indigenous communities, and rural and northern Canada is still limited. The current provision of provincial human AMR and/or AMU data is voluntary and non-standardized. All but 2 provincial programs are focused on human data, and there's only 1 AMR data piece from Quebec. But all of this data provision is voluntary, and there's no standardization between the pieces. BC does the best job of collating their data, but largely on the human side, this relies on public and private laboratories. And there's nothing compelling them to do it, and there's no standardized way to collect. Animal programs are expanding, as I mentioned, but they're still based on a relatively small number of sentinel farms with inconsistent animal commodity and species coverage across the country. Our novel evaluation tool was well suited for assessment of integrated One Health AMR, AMU surveillance programs and should be used in the future and probably incorporate a scope evaluation component. Canada has made incremental progress towards improving surveillance for AMR and AMU within the existing patchwork of programs, but we are still lacking a truly comprehensive national surveillance program system. We highlight that there are still significant gaps in coverage in both human and animal health, and there are concerns with delays in reporting. It is also important to note that there has been no new national investment in AMR-AMU initiatives, including surveillance, in the past 10 years. This was highlighted in a paper published earlier in 2020 by Van Katwijk et al. There are exceptions to this, of course, some research projects to fund surveillance components, and the newly funded AMR network by the Public Health Agency of Canada that's seeking to sort out a governance structure for the AMR network in Canada. This hints at the strong requirement that first we need federal, provincial, territorial leadership and policy to address AMR and AMU largely, and then also as well for surveillance governance, FPT data provision, funding, and reporting. And most importantly, we need sustained funding and resources for national integrated AMR and AMU surveillance in order to recognize a truly national comprehensive program. Thank you again to the conference organizers to speak today and for my colleagues as we prepare this work.